In U.S. Oncology, we conducted a randomized phase 2 trial in women with triple-negative metastatic breast cancer, and the women were randomized to receive either standard chemotherapy with gemcitabine carboplatin with or without a new agent, a PARP inhibitor, BSI-201. And the reason that we looked at the PARP inhibitors in the triple-negative breast cancer patients is that there's emerging evidence that the triple-negative patients have a problem with their BRCA1 pathway. They don't have a germline mutation of BRCA1 necessarily, but emerging evidence suggests that that pathway is not functioning properly, and so that the women have a problem accumulating double-stranded DNA repair problems, accumulating double-stranded DNA breaks in their DNA, and that may lead them to be reliant on this PARP enzyme for their DNA repair. So we decided to test that hypothesis about whether triple-negative disease would benefit from PARP inhibitors the way that we know BRCA1-associated breast cancer does benefit a lot from the PARP inhibitors. And so we randomized 120 patients, and we're very surprised at the magnitude of the benefit from the PARP inhibitor. This was an intravenous PARP inhibitor given day 1, 4, 8, and 11, with the chemotherapy given day 1, day 8 on a 21-day cycle. And the primary endpoint is the clinical benefit rate, which is defined as the objective response, at least a 30% reduction in the tumor volume by RECIST criteria, or at least being on therapy at least 6 months. We feel that that really connotes the group that gets the clinical benefit. And it just about tripled from 21% with the gemcitabine carboplatin to 62%. With the addition of the BSI-201, the response rate tripled from 16% up to 48%, and progression-free survival more than doubled from 3.3 to 6.8 months, and overall survival significantly improved from 5.7 months up to 9.2 months, and that's a 60% improvement in overall survival. And this is a randomized phase 2 that's going to have to be confirmed in a large phase 3 trial. Nonetheless, it's very encouraging to see that magnitude of a survival benefit in a very difficult to treat tumor such as the triple-negative breast cancer, which does not tend to be very responsive at all to chemotherapy. In addition, the BSI-201 had very little toxicity. In fact, we were not able to discern any difference in the toxicity profiles on the two arms of the trial. We couldn't see that the BSI made the chemotherapy more toxic in any way. So very encouraging results. We look forward to starting that phase 3 clinical trial immediately. I think that the favorable toxicity profile of the entire regimen, the gemcitabine, carboplatin, and the BSI-201, make me encouraged that perhaps worldwide this would be an acceptable regimen across a wide variety of women of different ethnicities and races. So I'm hoping that there won't be any differences in terms of toxicity profile. I would have no reason to expect that this would not be effective in triple-negative breast cancer patients across the globe, and the excellent safety of this regimen really is a benefit, and I think would therefore allow it to be more broadly applicable around the globe.